I'd like to introduce Brian Norris and Mark Silverberg to you. I came across Brian and Mark through the Health Data Palooza, where I think they won one of the innovation contests. And so that's how I contacted them. And they're doing some very, very cool stuff. And they have a startup called Social Health Insights. So just to give you a little bit of background, Brian Norris is, and Mark Silverberg are the co-founders of this company. Brian has he's a clinician. He has a diverse informatics background, having worked in roles for healthcare providers and consulting. He currently serves on the Indiana HIMSS Board of Directors and is a past board member of the American Nursing Informatics Association. He's actually certified in nursing informatics. Mark is actually an MIS graduate, although not from Arizona. We won't hold that against him. He is the technical drive behind the health and open data consultancy. He's a tech guy. He knows a lot about APIs and technology and so on. He was named one of Healthcare IT News' six health IT up-and-comers under 30. Mark lives in Washington, D.C., and he's got his bachelor's in business administration, master's in IS from the George Washington University. So what's another interesting thing about them is they get to work with a lot of cool technologies. In fact, I think they've brought samples of some of the cool technology like Google Glass, and they might be talking about it as well. Welcome, Mark and Brian.
Thank you very much, Sudha, and we're really excited to be here. We really believe in this is a perfect event for us because we are the intersection of developers and clinicians, and we really believe in bringing business people and business schools and healthcare people and health sciences educators together and solving these challenging problems. So I'm going to talk to you guys primarily about some of our work in social media data for HHS over in DC, Health and Human Services. They bring you great things like Medicare and health IT regulations, and they also do things with us such as monitoring social media, and that's how we got involved. So actually, we entered and actually met each other. The collaboration began under a hhschallenge.gov challenge. So the government, not just HHS, but NASA, all other different folks, put on challenges to challenge people like you and me to do cool things. Usually it has some money against it, but it's really more for the challenge, not the economic incentive. So Brian and I actually met over Twitter. He was looking for a tech guy familiar with Twitter. I was looking for a clinician because I truly believe that you need both, you need the patient, the clinician side, along with the tech to actually get anything good and efficacious done in healthcare. So we met and entered the challenge. We won, and now I'm going to give a little background of the challenge and our solution, and Brian is going to talk more about some of the use cases and opportunities. So the challenge was basically to take a list of keywords and a list of sort of taxonomies or nomenclature from the experts at HHS ASPR, which is the Assistant Secretary for Preparedness and Response, and sort of make some visualizations and some trending information and calculations about what people are talking about on Twitter. So just a disclaimer, when we talk about trends, it's certainly not, every tweet about the flu is someone who has the flu, but and as we'll show in a second, they are using it for what they call situational awareness and being aware of what people are talking about and things like that. So the first question we actually asked when we saw the challenge and we came across it was, why Twitter? And it's a pretty obvious answer, but here's some high-level statistics just to give you an idea. And these are actually pretty old. Twitter, since going public, hasn't been as forthcoming as you would think about how their user base is growing, but it is growing. And as you see on the slide, it's about 500 million users worldwide. If you made that into a country, that would be third only to China and India. So a lot of people and a lot of tweets, 500 million tweets per day. So that means on average, right, back in October 2 years ago, everyone who was a Twitter user was tweeting at least once a day, which is very good. Much more than Candy Crush that previous speaker was talking about. So, and again, it's, and not just Twitter, a lot of people, and not just youngsters, are on social media. So as you see, I think this is from Pew, and if you're ever looking for good statistics about health or communication or journalism, they're obviously a great resource and very well respected. But we can see that over the past few years, social is on the up. And so people are going to be talking about things relevant to their lives, and so people like our partners at HHS and other folks we've worked with are interested in what they're talking about. And there's not, unlike other companies, which, Coca-Cola might have someone looking at every single tweet talking about Coca-Cola in a good or bad way, they certainly don't have the time or resources to do it on a tweet-by-tweet basis. So we build tools to help them do that much more efficiently. Here's just some headlines about things that we've done and other people have done. You've maybe have read some of the articles as well, but this is definitely a hot topic in the area of big data and healthcare and social media. So it's really taking all of these unstructured, messy data, like I said, just because someone tweets about the flu doesn't mean they have the flu, things like that, and really trying to make sense of it all. So, and of course on Twitter, people are talking about crazy things. So you see, this is just a quick word map we made. People are talking about what you would expect, the flu, cough, whooping cough, but people are talking about really crazy other things as well, such as HIV and vomiting and other acute respiratory illness symptoms. So a lot of different things, and you can really start to understand your population from not just a clinical setting, but from a social setting if you start to listen. So when we got this challenge, we had some questions that we, of course, had to ask ourselves, and I think it's important to just talk through some of these to understand sort of our thought process. So the question really became, what problems do we want to solve? So we came at this, they just said, do something cool. So we had to take a step back, think about what do we want to solve, who is going to be the user. These are basic project management information system things, but as a recent MIS graduate, and actually I was still in school while we did this and started our company, it's really important to really tease out these questions and answer them either on paper or at least have an idea of what direction you're going in. Other questions with especially time series big data is what analytical intervals are important. Do we want to know tweets by the minute or the hour or day? And there's certainly performance and calculation implications if you want it by the minute as opposed to the hour, which we've settled on. Also lots of other challenges regarding geolocated data, privacy, et cetera, that we'll talk about. So you can go to nowtrending.hhs.gov. This is more or less what you'll see. It's been updated a bit since. But we started and took we decided to show a lot of different views of the data. So we've got time series, we've got word maps, we've got exportable lists and things, but the idea and what we really, and what HHS really wanted was a way to dig in and see deeper and to be able to dig deeper. So just like you could in Tableau or something, which is certainly much more expensive than our software, you can start to, from the time series graph, you can start to see the actual tweet and then see people in that area, et cetera. I want to take a quick second to talk about some of the technology behind it as well. Certainly if you're interested, and this makes a little bit of sense to you, we can certainly talk, and we're definitely here to share knowledge. So feel free to ask questions later on as well, and we can certainly talk if you're looking to do something similar. We're big fans of that. So basically, what we call the analytics pipeline, more or less, is we take tweets from something called the Twitter Streaming API. We filter it by keywords, which the API sort of lets us do. So we take the tweets, we receive the tweets that we're really interested in, and then we start to do some honestly pretty simple and bare bones NLP, such as classifying what condition the tweet is about, what the tone might be, what kind of context they're in, if they're talking about a child with the flu, or if they're talking about an elderly patient with the flu, or if they're at work or at home, et cetera. So that's what we call sort of conditional terms and context clues. And then we, of course, do the number crunching. We use something called MongoDB, which is really easy to get data into and then start to make some analytical jobs on, which are called MapReduce jobs, to start to see what the trends are and crunch a lot of data quite quickly. A little bit more about our technology stack. We use the Ruby programming language with MongoDB, and then for all of the, everything's pretty much open source. So for all of the web views, we use something called HighCharts, which is really great for for line graphs, pie charts, all this other stuff, and leaflets. So very much done on the cheap, if you will. We sort of built this within 6 weeks and have refined it, of course, once the government sort of adopted it as their platform for doing some social media situational awareness. But that's just something to keep in mind. It was really a quick proof of concept. I want to start to get into, and Brian will continue on, about what we've actually been able to do with this data. So the first step, of course, is getting your hands on the data, which if you're getting data from the EMR or something, you'll have to go through IRB approvals, HIPAA compliance training, all this other fun stuff. But the great thing about Twitter data is, since we're using public feeds, we just have to get it, which was a little bit of a challenge, but the real challenge is using it and finding those key actionable insights. But what I want to show on this slide is taking this non-standard healthcare data, which is, of course, social Twitter data. I think on the graph it's called Mappy Health, the former name of the project, and taking it and looking at what we call gold standard data, so information from CDC and WHO, and finding correlations. And of course, you know, these correlations don't mean that when people start talking about Twitter, flu on Twitter, that there's more flu out there, but we wanted to be able to start to look and see if that's a possibility. So as you'll see from all these good statistical tests, we did, when we filtered the keywords and did some magic hand waving, we were able to find some pretty good correlations with gold standard data. So we do think, and as Google has shown in their flu efforts and others in the space, that we really think that there is impact that social media data can have on healthcare. And with that, I think I want to turn it over to Brian, who's going to talk more about the application and opportunities.
Cool. So I'm going to spend a little bit of time talking about the, can y'all hear me? Everyone hear me? Okay. So first off, before I want to ask a question, how many of you actually tweet? Know what a tweet is? Have tweeted? Wow, cool. Right on. I don't have to explain that. So I'm going to talk about the use cases. I'm going to take you through a journey of a couple of different events that we helped with or were part of. One of them is the most recent event of Ebola, and we have some data to show as recent as a few days ago. But the first thing is, this is a quote of mine, and I've used it in a few different realms. If we remember the old telephone game, back and forth, social media has exponentially accelerated the telephone game. And what that's happened is that in situational awareness within public health and both healthcare, is that they now have to manage public anxiety going cyber and going viral very, very quickly. And so we're seeing rumors as recent as in the news as yesterday around Ebola that are false positives that people are putting out around, hey, this person has Ebola or this person traveled here, and the public starts to freak out. So we're going to talk about some of those use cases here over the next few slides. The first one is, this is influenza from last year. So as we were looking at influenza, the purple line is our tweets related to vaccination. So the CDC, as the flu was hitting last year, had a lot of trouble pushing out information. Other entities were really pushing forward on how do we educate the public about vaccination. Right? There's a lot of parents out there that don't want to vaccinate their children for one reason or another. There's a lot of misinformation out around vaccination. So we wanted to take a look at how they were communicating against the overall trend of flu. So the purple line and the blue line are ILI. The orange line is the WHO line items. Those two together are what's publicly reported and you hear on the news each week. What you'll notice is from week 42 all the way to week 1, it's sort of dead. There's just not a lot of information going out around vaccination. And then as the flu outbreak starts to explode, people start talking about vaccination more, right? We would say we want to see that curve kind of move over to my right. And to hit it home a little bit further, these are specific tweets coming out from the CDC, so monitoring how they're doing and where their information is going over time based on that. So if you look at all the way to the right, and the different week-by-week tallies, they're really not pushing out a lot of great information, and people really aren't retweeting and mentioning what's going on from the CDC in terms of this particular topic until it was too late, until people were already sick, the outbreak had already happened, we've already got a high prevalence of flu, And so they can start to use this information more real time and start to see how we're doing and how we're communicating. Because without it, they think they're doing well, right? And I'm not picking on the CDC, this is any public health group. They struggle with being able to monitor and manage how well they're actually communicating socially. Another interesting thing happened during H7N9. So as H7N9 really hit its peak, the WHO came out and said, you know what, there's so much conversation going on over Twitter, we're going to start pumping all of our guidance out there first and then put it on the web. And while that sounds like a small shift and a small change, that's actually a pretty pivotal change in public health. Saying that over a social media platform, we're going to now post all of our guidance and information first, and then we'll put it up on the web. So there's huge shifts going on right now in conversations around public health. So along the H7N9 vein, so this is just 2 weeks. So if you recall H7N9 really hit around April of last year. So this is starting at the very beginning of H7N9 and kind of working our way through the first 2 weeks. This is a minute-by-minute volume. So as Mark was saying, there's different ways to sort of slice information and look for signal. A lot of what public health is looking at is trends over a significant portion of time. So they want to look for things that spike up, over a day or over an hour and see what happens. But we can start to track minute by minute. So we wanted to do a use case to say, what are all these spikes? So as you can see, this tallest spike where it had about 100 tweets in 1 minute, it was reports of the bird flu coming out of China, and it was the second case, I believe. But, English-speaking tweeters are not the only ones that we have in our country. So if we want to start understanding socially what a population actually looks like, we have to start looking at linguistics and languages and start to cut information like that. And to be able to say, is it a Polynesian population? Is it a Chinese population? What is actually going on where, why, and within who? And so we wanted to test sort of the limits of what we could do. I don't speak Chinese, I don't translate Chinese, we got some translation of the word death, and we wanted to sort of track the trend. And so what you're seeing here is, again, a minute-by-minute trend of people talking over Twitter about H7N9 and the deaths that occurred both in Chinese and English. But we took our research a little bit further, and this was in partnership with some of the groups. We wanted to understand, is social now beating the news? Is social so fast, is that telephone game so quick, that before a public group like the WHO officially puts out a count or officially puts out a press release, has social already taken it in some form or fashion? And so what we followed was just one situation. So this situation that you see at the top from the tweet from the WHO, so far WHO is aware of 14 confirmed cases of H7N9 with 6 deaths, awaiting confirmation of 2 cases more. This early phase, which is about 12 to 16 hours, you'll see this pre-confirmation Twitter chatter happening about the exact same topic. So we were seeing information come out on Twitter prior to the tweet that you see up above, official from the WHO. Remember, they're putting out their official guidance over Twitter first. So we start to see conversations take place earlier than the public health groups can officially put the word out. And then you see the trail that sort of happens afterwards. What's interesting about this trail afterwards is if you start to think about what was happening during H7N9, about every 8 hours or so, 8 to 12, there were new cases that were being announced and released. So now we see old information being put out over social days later, and we have another view of what that looks like. The other way to start to cut this information is by time zone. So we all live in multiple time zones. We all have different trends. What's interesting about this is that you can start to see how information flows around the world. I'm going to skip that slide and come back to it. So along the lines of how information flows around the world, we also have been looking at what's the life cycle of a single tweet. So one piece of information, and how viral does it go and where does it go, based on time zones, based on all kinds of information. And then what does that mean to having the most current and most relevant information available to citizens from a situational awareness standpoint? We're seeing that happen and struggle now with Ebola and misinformation going out. So again, same vein, the tweet up to the top is a tweet from the WHO, and we followed it over its life cycle until it flatlined. And as you can see, the global, sort of all over the world, we had an immediate, retweet. Everybody was pushing that information out. Then a pause, people went to sleep or something. Then a small spike in Buenos Aires, the US, London, Beijing, Hong Kong, and Cairo. Another spike was caused within those countries. Then it paused again. And then, a small aftershock, if you will, again in Beijing, Perth, and Sydney, and then it died out finally. If you think of this life cycle, this thing went on for about 2 days. There was a lot happening in those 2 days. So it becomes vitally important, and what we're learning, and every day we're learning from these public health groups, is that this type of situation can cause misinformation. So they can cause themselves trouble by pushing information out because old information is still cycling around. Which brings me to Ebola. So as you guys all know as clinicians and just citizens of the United States, Ebola has gone rampant. You can't watch a news channel without hearing about Ebola, and there's a whole lot of information and misinformation out there. What you're seeing here from September 22nd till October 10th, so just a couple of days ago, is the initial trend of Ebola pre and post United States case being announced. So while Africa has been having its challenges with Ebola, these initial few days that are right about 10 to 15,000 tweets a day about Ebola make up what's going on over there. A Western country like the US gets Ebola and it spikes immediately. And what's been interesting about this trend is if you think about it, we jumped all to points and times where we were having 200,000 tweets per hour cycle through this system and getting tagged in all the analytics and all the things that Mark talked about. So because this is per hour, by the way. The red line is geotagged, and we'll talk about that challenge in a second. The blue line is total, and the green line are what we call natural tweets. They don't have a URL attached to them. They don't have a hashtag. It's somebody's natural thought, we think. It's original. It's not trying to retag some information that's out there. But if you think of this volume, this is huge. This is unprecedented. We've never seen this before. We trust me, the hardware and the software got taxed like you wouldn't believe. But we've learned a lot. When all of this is public anxiety. So we've had two confirmed cases in the United States, maybe 3, of Ebola. And there's 200,000 tweets per hour. This is not a great way of finding disease, but it is a great way of finding rumors and rumors management, and that's what our friends have been using it for. Beyond that, you can start to see where all of this is happening. And so via Twitter, what we found time and time again is about 1 to 3% of people that use Twitter naturally geolocate. So if you're on Twitter now, you can turn on your location and say, yes, please, you can tag my location with it. And that's what this graph is showing. About 1 to 3% of people do that, and then we can map and we can graph that. We can actually go down to the street level. We get within 11 meters of where you're at the time you tweet. And we can start to use this to see where the public anxiety is. So, we do the same maps for things like flu and about 200 other diseases. But when you're talking an outbreak situation, it's really, again, about public management and anxiety management. So we can start to see what's going on within the U.S. So, as you can imagine, Texas lights up. But the East Coast, the West Coast, if we were to zoom out on this, you'd see the UK light up, you'd see Africa light up. What you don't see countries like Japan and Russia and other countries light up over Twitter. And the last piece is around natural disasters. So about a year ago, we started tracking natural disasters. So this is really post-Hurricane Katrina. There's a lot of information about, how could social media really help in different ways during the time of a natural disaster. And so we've been tracking things like earthquakes, typhoons, you name it, hurricanes, floods, tornado warnings, et cetera. And each one has a different footprint. So what you'll see here is this is just 1 week last year. We have, if you go to the site, you'll see whatever's going on right now. I think you'll see a spike over the typhoon. We've learned that things like quick events like earthquakes and tornadoes and storm warnings, and they have really quick spikes. So, up over an hour or two and right back down. And it's people saying, oh, hey, this is going on. Did you know? Did you hear? And it's done. Things like typhoons and other longer events will last for days. And there'll be a lot of information that happens after those. And really big natural disasters where there's a human component, we've also seen last for days. So you'll see the spike go up, and you'll see it just sort of level off really gently. So that's another tool and another utilization that we've been working with in a situational awareness standpoint to help. But there is a ton of challenges. So when we talk big data, it is dirty data. It's, you know, I'm still amazed at what people will publicly put out over Twitter. If you want a good laugh, look up any sort of STD-related tweets. It's amazing what people will put out. But there's challenges, right? So good stuff. We want to know flu, cough, runny nose, fever. Can you go away? And then, you know, Justin Bieber goes somewhere and it spikes up. So you got to get rid of this stuff, or have a way of getting rid of this stuff. The geolocation is very challenging. So we spent a lot of time looking at, does the 1% to 3% sample of geolocation actually correlate against the total sample? And in some cases it does, and in some cases it doesn't. So it's definitely a challenge. And everyone we talk to wants to get to the geotagging. They want geolocated information because it's really the way that they're going to help manage in those specific cities. The challenge is that it's very, very low. And I'm not sure how to curb that challenge. It's through either education or what have you, but it's a privacy thing. You know, many of you in this room probably don't tweet with your location on it. I actually don't tweet with my location on it. Another way to go about it, and we've started to build some algorithms, they're not public, is starting to look at other components of a tweet. So there's a whole lot of information that's contained within the metadata of one specific tweet, including your profile location. And so we can start to look at different types of things that you tag, like your profile location, like if you associated it with some sort of Instagram piece, or if you associated it with another location service that allowed you to say, hey, I'm here. But there's challenges in that, right? So like Washington, D.C., clearly I know where this person probably came from. I don't know that they're there, but I know where they might be. I'm on Earth. You'd be surprised what people put in their profile location. There's Mars, there's Pluto, there's all kinds of stuff. That doesn't do any good. So when we started to look at profile locations, we started to look at it in layers and start to say, you know, where possibly could this person be at the most granular layer we could possibly get. So we cut it into a couple different ways. We cut it into global, we cut it into continental, we cut it into a country, we brought it down to the state, and we brought it down to the city. And you know, there's varying degrees of percentages of how we can tag those, but we were able to, and I don't have a slide showing it, we were able to bring that percentage of naturally geolocated tweets up by about 80%. And it presents a whole different view of information, so it's definitely a challenge. And then access to the data. So if you're familiar and you've tried to do some social media analytics using Twitter, the data providers really control you know, how you get access to certain types of information. So there's a couple different options. There's the free streaming stuff, and then there's the paid stuff, and both are great for depending on what you want to do. So that's definitely been a challenge. Linguistics and slang, people are using emoticons, they're using, you know, who knows what, right? So if you've ever done any sort of, you know, natural language processing, how people talk changes, and it's certainly changing over time and changing quickly on social media. So what we know today, we don't really know tomorrow. Beyond that, we've been working on, you know, looking at cities. So this is a map of the city of Louisville, Kentucky, and looking at where people are and where people are sharing information over Twitter. And so the idea here was that we could start to map out where we could push information and where people on social media, so if we're trying to reach, like some of the other speakers talked about, you know, a place where food's not available, or a place where we want to impact some sort of smoking or chronic disease, it's helpful to understand where they may be and where they may not be. Because we may be pushing those messages out over social, but they're not really getting to the areas of the city that we're trying to impact. So there are a lot of ways that you can start to understand very simplistically where people tweet, where they don't, where they're using social information. The same types of approaches can be taken on other social platforms. There are other emerging type platforms that go along with things like Twitter. So if you've heard of, you know, sort of crowdsourcing information or getting citizen information through different types of games and platforms like Flew Near You, This is a screenshot of Athena Health put out an app called Bugs and Drugs where they took all the HIPAA goodness out of privacy of looking at their EHR data, but you can actually go on their iPhone app. It's free. It's really cool. Put in your city, and it'll tell you what bugs are going around within all of the Athena Health systems that are there and what drugs they use to treat them and the prevalence of that. No patient information, but it does give you some great insight into what's going on in my community. Beyond that, there's a lot of opportunities for social. So we're starting to see a lot of conversation happen. So at the WHO, we're learning what they're using social media for. They're using it to push it out. You saw their tweet earlier. They're using it for situational awareness. They're using it to manage public anxiety and rumors. And as you can imagine, an organization like that has to keep tabs on multiple countries, it's very different in each one of those countries how effective that truly is. From the CDC standpoint, currently, if you look at the Ebola outbreak, they're trying to keep communication, trying to keep information, and trying to keep the right information out there. And social media definitely has a place and a play in that. And then as health workers, as a clinician, what really attracted me to social media was not all of the disease surveillance. It was the patients that come in and say, oh, I'm eating right, I'm diabetic, but why is my blood sugar up? And we can go to Facebook and see that they were just at the Krispy Kreme and ate like 10 donuts, and that's why their blood sugar's sky high, right? So how do we start to leverage that 80% of data that we don't have? No matter how good our EHRs are, we don't have that data, that behavioral data. So how can we start to glean that out of social media? And I suspect you'll hear more about that in a few talks this afternoon. And last but not least, we asked permission to share some user feedback. So we had to go through the right channels, so this is the verbatim, the official word we got back from HHS and ASPR just a couple of days ago. But as you can see, platforms like Now Trending and simple ways of looking at social media have provided them a quick and easy way to understand and look at how social media conversations around illness trend. It's really about being simplistic. It's not about finding out that you have the flu or not because you tweeted about it. It's about, again, looking at the whole situation and trying to find those areas in which they can start to get out ahead of rumors and other types of things. And then shifting gears a little bit, there's a ton of open data. And if you think about social, right along next to it goes open information and open data. And so we're really big into the open data space. We've been doing a lot of work with federal open data sets and emerging platforms like Glass, as Sudha mentioned earlier. So you can start to really innovate new solutions into the health field off this open information. So what you see over here to my right are Google Glass. It's a view of Google Glass apps that you're more than welcome to try out later this afternoon. And it's a pill identification app. So many times as a clinician, as a nurse, they brought my giant bag of pills in and I had no idea what they were taking. I sent it off to pharmacy only to hope to get it back about 3 or 4 days later after we already treated and treated the patient. And so wouldn't it be great if we had a quick way to identify those pills? So that's the use case that this was built off of. So now I can use an open data set from the National Library of Medicine, quickly say that the pill's red, it's round, it's 3 millimeters in size, it has an imprint of 100, and it returns back what that pill is potentially. That's just one use case. We can start to use them for more. And then over to the left are finding resources and text message resources. So with that, I thank you for your time and entertain questions.
I'd be interested to know in your analysis of tweets about the fever or some type of sickness, do you have a confidence ratio that you can identify tweets that actually pertain to sickness opposed to Bieber fever?
Yeah, that's a great question. So as you saw on the statistics that we had a little earlier, we did that and we filtered down a whole lot of tweets, but our focus really hasn't been on that. There's several groups that are focused in on trying to say, all right, I'm very confident that you're sick with the flu. We're more looking at patterns and trends of what topics and conversations are happening. So our approaches are a little bit different in that aspect.
I was wondering, in terms of population health management, how can healthcare organizations use this kind of information to be better prepared?
Sure. So, there's a few thoughts. So what we've done is just build it up. We've talked about the 200 or so things we track, so I think hospitals need to do a couple of things. One, as you've all been probably attuned to, you have social media policies of what you can and what you can't do and how you can interact with consumers and patients. But not many of them really analyze and see what's going on around their area. And so I think, tools like this can help them understand different topics. And it's going to be unique and different in each location, right? Texas is really hot over what's going on in Ebola, but they're also, they were one of the worst states in the country for influenza last year. So, they're going to start wanting to look at flu conversations here really, really quick. They may also want to track chronic disease. And so, if you live in a part of the country where smoking is rampant, alcoholism is rampant, other types of things are rampant that affect your populations, those are the types of conversations that you might want to track and start to look at. I think there's a big opportunity for providing some more automated type reports back to folks that are starting to manage social. Because let's face it, in healthcare, we really haven't had a consumer focus like CVS and Walmart until now. Now we have to sell to consumers. Now we have to understand what those consumers want, and now we have to be really concerned about what those consumers are saying about us. So the other use case is we've shown at a few entities just in a proof of concept, people actually talking negative about the entity while they're hospitalized over social media. And so if you can understand that they're doing that and then send somebody to go fix that problem, the likelihood of them having a better experience and them coming back and your HCAP scores and other things being better is probably more probable than letting it happen and letting it go and letting others sort of respond to it. Sorry, I forgot.
No, I would want you to answer.
Hello, my name is Monica. I'm an MIS undergraduate student here. My question is mostly about the geographic data you guys have been collecting through Twitter. Are there any things happening right now to integrate that geographic data that you guys are able to find trends with existing studies on geographic trends in healthcare?
Yeah, no, that's a good question. So back to that slide, and definitely get in touch if you want the slides. We're more than happy to share. But it's really hard because a lot of the data sets that we come across don't have the granularity of geographic data that we have. So like the CDC data, which is by week, whereas we're by second if we want to. That is usually by state or even HHS region, which there's about 8 or 10 in the country. So when possible, we try to sort of mash it up and do those correlations. But a lot of the time, it's not the data that we have that's the problem. It's the data that we don't have that's the problem, right? So being able to get the data to be able to do that correlation. Same with knowing if the person who had the flu was the same person who was tweeting about the flu. That data set just doesn't exist, probably for good privacy reasons anyway. So we try to when possible, but it's really a lack of open data, and those are sort of things that we try to push our counterparts, whether it's private healthcare organizations, public ones, to sort of share so we can all glean information from it.
I would say to that effect, and we can't share the information, we've been involved in a study of looking at alcohol-related tweets within a geographic location and actual ED visits associated with alcohol.
Yeah.
Sorry. We've been involved in a study, and we can't release the results because they're not released yet, but we worked with some researchers, some physician researchers around looking at alcohol-related tweets in correlation with alcohol-related ED visits. And starting to look and say, is the social conversation, does it feed at the same times as folks coming into the ER? So could we potentially use social media as an early warning indicator of when this is going to happen? Very interesting results. Again, I wish I could share them, but soon that'll come out.